Sorry. Shida iko pande gani? Hiyo kamera sana. Chapo kwa hiyo. Okay, straight. Yeah, yes, sir. This side. What is the problem? Should I go? This is I don't need to see the sister. What is the problem? Should I go? Shida kwanza machine zimeshakitama. Mtoto kwa hizo machine azifanye wapi? Haito hapo huyo sister. Sister kuonekana kuna pale.
Sikize kuna shida. Consultants do not come to work. Kwa mama wanakufa.
Ndio kuna pamoja kuna maiti mengi kwa pamoja nataka kwenda. Wapi kuna shida? Wewe ukae. I'm just having a meeting and access. Haiko shida gani? Mimi. Mr. Gavana, shida ni our consultant. We are all nurses. These are nurses crisis meeting. Yes. But the neighborhood crisis meeting, Mr. Governor. But we are issues zenye zinatoka na originate from other departments that are affecting us directly. Our consultants. They don't come to work. Yes. And if I kuja kwa work anakuja 1 hour. Na mama wana deliver vipi? Nimetumiwa picha ya maiti zaidi ya 5 zilizotolewa.
Yes.
Nimetumia pikipiki kufika.
Yes. Na mama anaadmitiwa 2 weeks in labor ward. 2 weeks. For God's sake.
Don't expose them, not using.
For God's sake, admitting a mother in labor for 2 weeks in labor ward. For elective CS.
No deliver is normal.
No. These are mothers who are supposed to go for theater. And just because now there's no one.
Your Excellency, can we not be recorded, please?
No, don't.
Yes.
Yes.
So,
number one, we are saying consultants do not report on time, Ama they don't come for this.
They don't even come to work.
Consultants,
They come.
They only come when they are called and they can come for 1 hour only.
Or you don't take their faces, Lakini nobody. Skiza, hakuna mtu atafuta kazi hapa. Sasa, I'm here to solve these issues once and for all. Sasa, we are looking for a permanent solution to this problem. So, usiogope. I'm the governor of Nairobi. Sasa, nobody atawa intimidate hapa. Sasa, so you just be free. Yeah? Open up your roho. Nisikie shida hapa. So you are all nurses.
Yes.
So problem number one, consultants do not come to work.
Yes.
Mothers are suffering. Yeah.
That is why we are getting the freshest. We want them freshest. Because these mothers have stayed in the ward for more than 2 weeks. When they start laboring, they deliver precious because they are not taken for cesarean section. You see, on time. If they could have been taken on time for cesarean section, we could not get the freshest piece that we are having. And then we have also ruptured abdomens due to delayed cesarean section, due to these mothers with previous scars. And then when we deliver a freshest, it comes back to you as a nurse, because you are the one who was in contact with this lady, and you have to write a statement. Why did you deliver a freshest thing? Why did this mother get a ruptured abdomen? And then you are fixed there. The doctor is nowhere to be found.
There's some languages I don't understand, the medical. What do you mean by fresh? What do you mean? Oh.
Anatoka ndio fresh.
Mtoto anayeoza
Yule hajaozea kwa
Ndani ya
lakini amekufa. Due to the delay ya
yes, that delays, what is bringing Mama Mizan.
How many babies have we lost so far? How many? Who was that number? How many? Like how many per day? We lose how many babies per day?
That one you cannot say it was maybe per day. Depends in the case and they are recorded.
Yes.
They are being audited at the end of the month.
Yes.
So at the end of the month, that's when you can get the actual number. Maybe from the daily report. Because they are recorded daily.
Okay. Okay. Number 3.
Number 3, we have a problem whereby we as nurses were the one who are direct contact with the mothers throughout 24 hours. Even the mother when they come from home, the first person to contact is a nurse. The first person to ask direction is a nurse. But we feel that our medical superintendent is not respecting the nursing department. Because if you cannot work with us and listen to us, because she sees that she's too superior, she cannot even consult anything with the nursing department, nursing office. Here we have a deputy chief nurse and we have the assistant chief nurse.
In total, how many are you? In total? In the entire hospital, how many are you? The total number of nurses?
Nurses in the hospital? 162.
162. You work on shifts?
Yes. Yeah.
How many during the day, how many at night?
The shortage is always there. Governor. So
Labor ward, postnatals,
Yes.
prenatal.
Can we say talk about labor ward? Because it's labor ward.
Yes.
In the morning, you find like there are like 7, 8 nurses. When you are so many 11, that is during the day. At night, we report to work with 7 nurses for 12 hours, all 6 nurses for 12 hours. And this work is overflowing. Mothers are laboring on the benches, some on the floor. We don't have enough. Some are sharing 3 per bed, 2 per bed. And we only 7 nurses. The workload is just too heavy.
What else? Another sensitive problem. The suffering the mothers are undergoing here
And provision.
during labor.
Where we wanted to, maybe we came for a crisis meeting today. The CSSD brought the machines were not working for some hours.
They are working now.
They were not working. So they had to settle the text.
They've started working.
They have started.
Jacob, are they working now?
Not
Because the information I have here from one of the mothers who just delivered, she lost her baby. I think the machines were not working. Alizaa kijua kali.
yeah. Actually, that's what they're conducting now.
And I personally I have a
We
video.
are improvising.
That mother sent me a video of 2 walikuwa wamekufa wamewekwa kwa box.
As per now, we have 6.
6.
I think,
Do you have a morgue here?
Yes, yeah. Temporary mock.
I think what is happening in this hospital.
Me, I didn't want you in this meeting.
Let me just talk.
I want to hear from the nurses.
I'm talking
Yes.
because I'm in management. I'm talking.
Sitaki onekana wewe ndio umeniita. Nimeitwa na a concern
I understand
mother
government,
yule ame.
and I don't fear because if someone to send me home, but they want to send me if I'm not working.
Even you should know
Even
that.
this-
Musiogope ile mambo ya administration ya ushenzi ya zamani.
These nurses.
Nobody will fire you
I
from
think-
this facility. Take it from me. You can take that to the bank.
Excellency.
Hakuna mtu atawafuta kazi. I want to know the truth. Yeah, how our mothers
What's
are
happening
suffering here.
They fear. There's something said.
Hakuna mahali watapelekwa.
On leadership.
Don't take their faces.
There's something they said on leadership. This hospital needs to have a leader.
Wachana na hiyo mambo ya siasa wewe.
Not-
Can you get out? Can you get out? Can you get out, please? You just kaa huko nje. Yes.
Okay, Mr. Governor, the crisis came due to the CSD machines. But there
The
was a
crisis
memo
has lasted for how many days?
from Friday. There was
From
a memo
Friday.
that was written last week, is it true? By the medicine.
Yes.
That the CSSD machine is only going to work for 12 hours. Because
What do you mean by CSD machines?
Okay, the
No,
machine.
me, I'm not a nurse. I'm not a clinical officer, so you have to elaborate on these terms.
Okay,
I'm not conversant with the medical terms.
Okay, now this machine,
Yes.
we have those equipments that when you're
For sterilizing.
Yes, it is for sterilizing.
So you call them CSD.
CSD machine.
CSD.
CSD.
CSSD. Yes. Yes.
So it was like it is only going to work for 12 hours
Yes.
only.
Yes.
And we were like, if it works for 12 hours,
Yes.
we cannot estimate the number of mothers who are coming to deliver during the night.
Yes.
That if I'm left with 10 packs to deliver these mothers, and there is an overflow of mothers during the night, what are we supposed to do? We deliver the 10 mothers, and the others we do what? Where do we check them? Or what do we do with them? This is a crisis that has brought this meeting. And due to this, we heard that the machine is now working. We are also asking, is
It
also
has started working
It
today.
has started working.
Yes.
Is it still continue to work for 12 hours? That is our
You see, the problem is with me because immediately I received this information from some of the mothers who are here. I started calling my minister, my CS. I think they have called them. Na hiyo ndo maana imefanya kazi. So they are all working the machines now. Why are they being shut down, the machines? Why? Huh? Is there any problem? Is there any technical problem? What?
It works.
Can you give us permission to speak?
Yeah, so the information was,
Yes.
because it's overworking, so it becomes faulty more time. So can there be a provision, get more machines, because the one that's functional is getting faulty because it's overworking? Yes.
Okay.
So that's another solution.
So who is to blame for all these complications? Management, huh?
Where the management has a crisis, total crisis. It's like
Yes.
everyone is
Maybe
working on it.
just to report on that.
Yes, you are who?
Alexander Tanzania.
Yeah.
The
You are,
hospital administrator.
you're the administrator. Yes.
So what happened is our
Yes.
machine broke down.
Yes. Due to what?
It has been breaking down severally. We
Yes.
called our biomedical engineers and they
Yes.
say the machines are being overworked.
Yeah.
We see how we can reduce the working time.
Yes.
And last week is when our medsup suggested that we work on a 12-hour shift to allow the machine not to break down frequently.
When there is such a problem, where do you report to?
The machines when they break
Yourself,
down,
when there is an issue, you are responsible to who? You report to who?
myself, I report to the mayor because
The superintendent. Then she reports to
she reports
maybe the
to
director or chief officer or the minister. Okay.
So the machine broke down, it was repaired.
Yes.
Then yesterday it also broke down, even though the biomedical engineer is saying it's not actually breaking down, but whoever was on duty
Yes.
did not know how to operate it fully. We liaised with Kenyatta National Hospital.
Yes.
That's where we took our packs for sterilization.
Yes.
And they were brought back by around 8 p.m.
Yes.
The hospital had adequate packs
Yes.
to serve our flight. And then even this morning, the biomedical engineer are there working on it
Yes.
so that such will not repeat again.
Okay. So I think we'll handle that immediately. Yeah.
Actually, there were some allegations. Kindly speaker, when you told one of the ladies here that we are going to stop admitting the
Patients or mothers.
That was
who are
a
due to
complaint from
deliver.
the nurses.
Yes.
Which they were raising to the management that they cannot continue admitting mothers. If there are no equivalents, those instruments which we use to conduct the deliveries. Those were the allegations.
Lakini bwana administrator, you know very well.
Yes, sir.
During our previous budgets, health, we gave you the highest allocation of 7.6 billion. Now, since we don't divert money to other uses, really what happened before, why don't you request for another machine? You do a requisition through your bosses, ikuje, na mimi mambo ya health spending mchezo, we just do it. Yeah. So. I want you to take me to the morgue myself, only without the cameras. And then, yeah.
We also want ambulances stationed in Pumwani because they were withdrawn because ambulance services are under county.
Yes.
So Pumwani does not have ambulances stationed here. So when
How
we
many
get referrals,
ambulances did you have
There were
before?
3 or 2.
3. Where are they now?
But
Where are they taken?
I don't know, all over the county. So we want ambulances here, and if
Like how many ambulances you need?
3
For what?
which
For
are
referral?
fully equipped,
Yeah,
because we
for
get not necessarily
For helping, bringing patients, bringing mothers
yes,
from.
bringing mothers
Yeah.
and taking mothers.
You have
to
a
referral.
hotline number here, a hotline line, a number.
We have
For patients to call
number
from-
that we have
yeah.
for health centers to call when they need mothers to when they are referring mothers to Pumwani.
Is it working?
Yes.
Yes, the kabambe is working.
Is it to an individual line or it's for the hospital?
It's for the hospital.
For labor.
Okay. Ambulances, okay, it's the hotline for labor ward. Okay. Any other sensitive problem?
Any other sensitive?
Maybe just to comment on that, our ambulances are in the garage. One was involved in an accident, but the other one was taken so that it can
Which
be
garage is this?
along Kiambu Road.
Canberra, that is called executive.
Yes.
I know that garage. I passed through there. Nataka kumaliza shida za ipo Pumwani. Any other problem?
Any other problem?
I conclude.
When we want to, like now, we want to achieve this universal health care, and maybe our aim is that no mother should die or baby should die during that process of delivery, and that one need manpower of nurses. Kindly, we are requesting you as nurses from the ground, employ more nurses who can be able to work at this place.
But we have that proposal. I think we are advertising through the county public service board by Friday.
Yes.
No, that but for Thursday for Friday. We need like I think 80 nurses, 19 clinical officers. About that circular with me. Yeah, we are doing.
So
all of them retire.
There are some who retire, some who resign.
Yes, that one we are working on that actually. Yes.
Okay, another pressing issue is that in labor you find that we have an overflow of mothers. I understand there are some wards which are closed and they can be opened. You find that sometimes
they are closed due to what?
Manpower.
Shortage of staff.
Yes. So you find that you are told you cannot take mothers to theatre because theatre is full. Because surgical wards, you want mothers to be discharged to get beds for the mothers who are in theatre. And this one now creates overload in labor ward. So if there is something you can do for Pumwani to try and to check whether these wards...
So like today, Administrator, I've understood that. Like today, how many consultants we're supposed to have right now? Like right now? The ones who are supposed to be on duty, can we have a list of that?
Maybe if we got the theatre, sir.
How many are supposed to be present? And how many are present, how many are not reported?
According to your
the duty roster.
Where do they report?
The duty roster is usually with the doctors.
Which doctors?
There's supposed to be two
consultants. How many are present now? None. So in case of emergency, mtu anakufa tu.
We have the medical officers.
But what is the rule? They're supposed to be here permanently.
Yes.
I agree with you.
And that is why the outcry from the nurses that the consultants are letting us down. And we want to appreciate the other day when you said the American doctor, they actually reduced the backlog. They actually worked the second
So do you have the names of the doctors who are supposed to be present and they're not here right now? They're not present. Do you have the names? Can we get their names?
We'll get their names. And then when governor, what they were requesting, we are requesting for the lifts
to be operating.
Because if the lift is operating, right now we are using 2 wards for the post-operation. They are not working. So if we can have the lift to be replaced, so that we can use the first floor ward as a post-operational ward, which is bigger than the 2 combined.
So it's not operational right now?
No, the ward is operational, but for the other different mothers, not for the post-operational mothers.
Kama wewe si nasi usiingie hapa. You are Utakuja hapa kwanza kwa intimidate. So you take, okay, I hope you have my number. No. Okay, you check it because after this I know you'll be intimidated.
There may be one last thing.
Yes. 0739 555. Like you are busy, just send a message. 555.
0739.
Another one, 4722 156 700. Another one, 0722 886600. Who's in charge? Yeah. Ukiona hapa akisimamishwa kazi ama akipata sababu ya kulipua hii maneno, you just report to me. Sawa? Bila mafuta ndo ataenda.
Chief Nurse Mr. George.
George, tumeongeza. Haya, the last one.
The last
Wacha huyu alafu wewe.
Okay. The last point, maybe through your office and the county public service boards, because you're employing 80 nurses. From George's office, he can bear as witness. We are short of 50 nurses in Pumwani. Yes. So if you can have another alternative of local nurses who like come to just.
Do you have interns? The ones who have come for.
No, we don't have.
They just come and they go.
You're all in the payroll, you're all in the system of the county, yeah?
Yes.
Okay, maybe last week. We are, as nurses, we've been waiting for...
And why are you not in uniform?
Sorry?
Night shift.
Night shift. Yes. We've been waiting for promotion for the longest time. So wengine wameenda shule, wengine wamekaa, job the same. So pia morale is
Since 2010.
No promotion, eh? Yes. We are working on that. We are working on that. Okay. Actually, the entire system is rotten. We are counting for 7 years. They are promoted from the inspector department, all the departments. They are working on that. So you have by now, in case of any problem, take me to the morgue.
This is our team.
Okay.